Hi, I'm Nicole Werner, and I'm going to talk you through chest tubes. First, let's talk about what supplies you need. You'll need a scalpel to make your incision, a blunt dissecting instrument, a chest tube, preferably preloaded with a clamp at the tip, a place to put sharps, a suture and driver to secure the tube in place, and sometimes pickups can be useful. For this demonstration, I'm just wearing standard gloves, but you should wear sterile gloves, a surgical gown, and a bouffant or equivalent. This is our patient. Placement is really important, and I like to think of the triangle of safety. And its three borders are the lateral border of the pectoralis muscle, the anterior border of the latissimus dorsi, and the inframammary crease. I begin by making my incision. I feel for the rib, and I place my incision directly over the top of it. Then I take my dissecting instrument, and I spread through the tissues on top of the rib, dissecting just over the top of the rib. When I get close to being in the pleura, I use my second hand as a stop guard. So when I press into the pleura, I'm not accidentally poking in too far and injuring the heart or the lung. A lot of times you will feel a gush of air as you do so. Then continue to spread with your clamp to make a tract for your tube to be placed. I personally like to insert a finger to just confirm that I am into the pleura space. Next, take your chest tube and insert it through the hole you just made. Once the tip is in, you can release the clamp while holding your chest tube, and then angle it to the position you want it to be in. Making sure the chest tube is inserted far enough is important. While this is just a mannequin, it doesn't matter much, but for most people, you need it to be inserted 8 to 10 centimeters to ensure all the holes of the chest tube are within the pleura. And the last step is to secure your chest tube in place. There's many ways of doing it, and therefore there's not one right way of doing it. The key is that it truly holds your chest tube from slipping, and that it's airtight around the chest tube so that air does not leak around the tube. In the trauma bay, needle sticks are common, so dispose of your needle quickly after going through your skin. For me, I tie a simple knot to close down the skin space first. And then I connect this suture to the chest tube. When I tie my knots, I tie quite firmly and I try to indent the chest tube. You'll never really occlude the chest tube, but if you tie firm enough that the chest tube indents as you tie your knots, it's probably tight enough and the chest tube will not slip from within your suture. I usually use a pretty heavy suture, like a No. 1 Ethibond or an O-Proline. Less than that, it's pretty easy to rip your sutures out. After it's secured, you would connect it to an atrium, which we are not going to show. But here you can see the tube is well secured.